Joining us today is the House Majority Whip, State Representative Bryan Cutler. Representative, welcome.
Thank you.
We're going to be talking today about ALS, which is an issue that is very dear to your heart. So as we start off, can you tell us why ALS is so important to you and how it affected you and your life as a caregiver?
Yeah, when you look at how I ended up here in Harrisburg, you really have to go back and see how ALS or Lou Gehrig's disease touched my life. When I was 15, my mom came down with symptoms, and within about a year, my father did as well. And they were one of 8 couples at the time who were ultimately both diagnosed with Lou Gehrig's disease. They were one of 2 that were still living at the time of their diagnosis. And so my sister and I, who was 2 years younger, we were put in a position to help run the house, which involved being a caregiver, both directly as well as in supervisor roles. And it's something that, we had a great response from our community. It certainly left a lasting impact on me as an individual. I ultimately felt like I was, I went from X-ray to hospital administration to law school, but it was really because of the support that we got from a variety of community organizations. It was our church who made meals all the time. It was our Lions Club who cut firewood for us. And because of that, my sister and I, even though our lives were very disrupted in one regard, still led normal lives. We worked jobs, we did track, we were able to still be involved in our community. And I always felt I owed a very great debt of gratitude to my friends and neighbors who helped us in our time of need. So when I decided to go back to law school, I wanted to use my law degree to help those same people. And that's ultimately how I got involved in public service. And then when I got here, it just so happened that the ALS associations were beginning a grassroots effort for a specific budget line item to help provide for care, because the nuts and the bolts of providing care, it's way more cost effective and simpler, quite frankly, and better patient outcomes to help folks stay in home and keep them there as long as possible. And when you look at that as compared to potentially going to a skilled nursing care facility that costs $80,000 a year, that in many times the state ends up paying the bill because many of these folks qualify for Medicaid, it made both good budgetary sense as well as patient care sense to advocate for that line item. And very excited to say that we were successful, and we've continued to work on that each subsequent year thereafter.
We know that with a disease like ALS and just about any other disease that affects a person's life, it's important to ensure that there's, a standard of care that is, above and beyond, what is expected. However, some people don't realize that that excellence in care should also extend to the caregiver. Can you talk to us a little bit about that?
Sure. We were engaged with multiple organizations. One was the Hershey Medical Center had an ALS care group. It was called Patients with ALS, or PALS. And then we were also involved with the Philadelphia chapter of the ALS Association. And since I've gotten here, I've gotten involved with the HOPE Coalition out of Philadelphia and some of the great work they're doing there in terms of their clinical disciplines and the way that they overlap. And I know that they've got a new partnership, which I think is very important, because when you look at our efforts as we go forward, we've been successful because we've been able to collaborate and to all pull in the same way. And look, we all want to have ALS to be cured, but the reality is, while we're working on that, there are a whole host of other supporting issues that we need to work on. One is the research that supports that. One is caring for those individuals in a holistic and complementary way, which the clinic does so well. And I think when you look at that, that is, it's good for the patients, it's good for the families, and it's good for the Commonwealth. We have a lot of very prestigious institutions here in the Commonwealth. We should use those resources in terms of the medical schools and the research capacities and everything we have. And I think that we've got a great treasure, but the reality is we also have a future risk, which we're all working to avoid. The Commonwealth had the highest number of deployed guardsmen in the war on terror. The reason that's important is, many folks know that National Guardsmen and veterans in particular are twice as likely to come down with Lou Gehrig's disease. So we need to have both the care support in place as well as the research. So it's important that we all work together for their future.
And you mentioned these partnerships are important, but specifically, why is the partnership with Temple so important specifically to the city of Philadelphia and the Commonwealth of Pennsylvania?
I think it's a great opportunity to recognize the excellence in research as well as the clinical advocacy and many of the benefits there. We're going to be able to really meld both care and research in a great way, I think. And I think it's great for Philadelphia because it will now be an innovation center. It will draw people here so that want to be involved. And there's a whole host of offshoots that I think will come from this. And it's important that we continue to work collaboratively in that way.
As far as working collaboratively goes, why is it important for these groups? You mentioned PALs and whatnot. Why is it important for these groups to have a solid relationship with the legislature?
Well, I think the big thing is they can all be a resource for us as legislators. When you look at us as policymakers, we're expected to have a breadth of knowledge on a whole host of issues, so everything from agriculture to Lou Gehrig's disease to mining and to everything in between. And when you look at that, I think it's important and one of the things the Lou Gehrig's community has done very well in terms of advocacy is make those connections with their local representatives. And by identifying what the problem is, we're able to then better identify the solutions in terms of caring for these folks at home, what they need from a research or a medical standpoint, as well as what we need as a community support structure in order to help support that. And to the extent that we can work together to make that happen, I think that we're in a very unique place to have Philadelphia really be the epicenter of that.
What have you yourself been able to accomplish since being elected here to help ALS and other diseases out?
Well, in addition to my own personal advocacy, I think part of it is help building these coalitions in regards to Lou Gehrig's disease and many of the other neurodegenerative diseases. I think it's important to recognize that it's not just ALS in one column and MS, and the entire family of diseases needs to work together for that common goal. Because I think ultimately we will find that many of both the care approaches as well as some of the research is going to overlap. And since there's a limited amount of resources, I think that we need to do the best job we can in focusing and making sure that we have the best outcomes for all patients in that regard. From an advocacy standpoint, in addition to my personal up here, one of the things that we advocated for was the line item in the budget to provide for direct patient care. And that's something that should continue, but indirectly, many of the schools' research dollars go towards a variety of projects that ultimately support this. I think it's important that we recognize the impacts that each of those has on all of the different disease groups. And I think it's important that we as advocates for each of our individual causes also recognizes that we're really building a better patient care model in terms of treating individuals. And I think ultimately that's going to be very exciting for Pennsylvania, both as a science and innovation center as well as a patient care destination in terms of caring for many of the individuals who, as I alluded to earlier, unfortunately are kind of in the pipeline.
You mentioned what's been done so far. Looking into the future, where do you see the state of this disease going?
Well, I mean, ultimately, I think when you look at something like the Ice Bucket Challenge, the goal is to have a cure. And they've already identified parts of the genome that are new since that. So that kind of influx of money was great, but there's still a lot of work that needs to be done. It's going to be the physicians, it's going to be direct caregivers, and everybody in between, and the research scientists who are working on this tirelessly until we get a cure. In the meantime, I think we need to stay focused, and we need to have some intermediate goals as well, which are, in terms of advocacy, is just understanding that we all need to be pulling in the same direction so that we can have the best outcome that we can hope for all of our patients.
And finally, is there any other areas or comments that you'd like to make before we end today's program?
No, I just want to recognize all of our patients across the Commonwealth. There's about 900 that currently have ALS, and then you start adding in many of the other disease groups, you have thousands. And I want them to understand that as we continue to craft state policy that could potentially impact them, I want them to be a resource for us as lawmakers, and just encourage them to reach out to their lawmakers, develop that relationship now that way, and just say, look, this is who I am, this is what I have, and if you ever have any questions about patient care or insurance problems or whatever it is that they are personally struggling with on any given day, it's invaluable for us as policymakers to have that information. I just encourage them to get involved.
Representative Bryan Cutler, thanks for joining us and for giving us more information about ALS.